So I'd like to kick off this afternoon's session by acknowledging that once again we are meeting on the lands of the Gadigal clan from the ARIAA nation. That's challenging for me to remember because typically I'm standing up saying that I am on the lands of the Kaurna people of the Adelaide Plains, because that is where I am from. And I would like to acknowledge that our First Nations people were the first nutritionists on this country. Now, on to our first speaker. I would like to introduce Dr. Rebecca Bilton, who is Director, Workforce Capacity and Capability at ARIAA, which is the Aged Care Research and Industry Innovation Australia. Dr. Rebecca Bilton is a Senior Research Fellow and leads the Workforce Capacity and Capability to deliver ARIAA's Innovator Training Program and Innovator Network. She brings expertise in developing collaborative research partnerships and the management of large local, statewide and national research translation projects in the aged care sector to improve care. Please welcome Dr. Rebecca Bilton.
Thank you, Morgan. I have the pleasure of trying to keep your attention after the post-lunch slump, so I will do my best. My title, as Morgan mentioned, was Building Workforce and Leadership Capacity to Support You during the change process that you undertake as you tackle the aged care reforms. Morgan, I would also like to acknowledge that we meet on the lands of the Gadigal people of the Eora Nation as the traditional owners of Sydney. So this is completely unsurprising to all of you because you get the, privilege, but also the challenge of having to deliver on this massive work piece that the government has tasked us with and that our older people expect from us. So I guess my job now is to try and help offer opportunities to support you as you undertake all of this work. So in addition to all of the aged care reforms, we also have increasing complexity of our client presentations, and this isn't anything that you don't already know. So we have the complex needs of our clients and we need to design and deliver care and train our workforces and design solutions that can meet these needs of our older Australians, no matter where they live. And in addition to that, as we're all very well aware and have heard from probably multiple times today, the coming market is also changing, so the emerging market needs to adapt to the changing requirements for care and services, and this not only includes the changing demography of our older people, but their changing wants and needs, their expectations. Traditional aged care services are often seen as less desirable. They're often, but not always, increasing self-funded retirees who, with that self-funding, want greater flexibility in where their services are purchased and provided. And they're increasingly tech-savvy compared to generations that have come before. And so we need to provide diverse, responsive and person-centred care approaches with the appropriate safeguards in place. And we need to adapt our business models to change and be flexible to provide quality services that are fit for purpose. We also, as well as all of that, if it wasn't enough, have workforce challenges, and this is nothing new to you guys as well. But in facing workforce shortages and staff burnout of our existing care workforce due to the management and implementation of reforms, the constant regulations that we're required to report to and meet, we have a workforce that lacks skills and confidence to support this change and to undertake reform, as well as doing their business as usual of providing fantastic care. We have the data that shows that we're still trying to stem the tide of workforce exit rather than the increase in workers that we actually need to ramp up to deliver on the increasing numbers of older Australians that will come in the next couple of decades. So in summary, I guess we're striving for quality services and care for our older Australians. We want a capable, effective and flexible workforce that need to do things differently. We want efficiency in delivery of the aged care services, no matter where they are or whom they are for. And we need growth and new models of business. So all of these complex problems need multifaceted approaches to support them. Our workforce is scarce, it's fragmented, it's inconsistent in its capability and capacity, and in many situations the workforce is very thin and they're often exhausted, but they are mostly passionate and committed, and we need to support them. They deserve to be supported to undertake their roles and to be provided with opportunities for them to grow and innovate to improve their job satisfaction, which will help empower them to actually deliver better care as well. So ARIAA is a Commonwealth funded entity and we offer free resources and services to help with some of these issues. I'm not selling you anything today. So ARIAA, for those of you who aren't aware, is an organisation, again, funded by the Commonwealth. It's a recommendation from the Workforce Task Force report, A Matter of Care, and it's also featured in the Royal Commission. And those bodies identified that the sector needed to increase capacity and capability of the workforce to pick up evidence-based practice and to adopt products and services and technologies and grow and improve on how you deliver aged care. So my remit today is to talk about building workforce and leadership capacity, and we do this by, now I'm going to see if this works, technology, yep. So we do this by optimising our workforce and, excuse me, through implementation of best practice and evidence to be more effective, efficient and deliver on safe quality care. And we also do this by energising the workforce. And we do that because we believe that energising individuals, both at the front line or through their management levels, in your workforce can improve the growth, which is important for staff satisfaction, as I said, and increase skills. And through innovation, everybody grows and benefits. So specifically, I'm going to talk to you about how to identify workforce skills which can be enhanced and how to access support and training and the resources to do this. And I'll also present at the end on how to develop leadership, not management, leadership capability within your teams and within your staff to undertake innovative and creative change approaches that are much needed to implement quality care. So ARIAA, through its tender deliverables, has demonstrated that it's uniquely positioned and well positioned to offer support in training, partnership and knowledge resources, and it also does a lot of work in the advocacy and networking spaces. So we do that because we are truly industry facing. We're solutions focused. We all know what the problems are. We need to be solutions focused. We provide best practice evidence that's high quality, understandable and able to be adopted, adapted and contextualised. And Morgan gave me permission to say we take fantastic evidence that's written in really wanky academic language and we make it accessible to you in the workforce sector. And that's really our main goal. The research is fantastic, it's just not being implemented well. And you as sector staff don't have the supports that you need to be able to access it well. And I'm allowed to say that because I've got a DR in front of my name, so I'm allowed to throw stones. So in doing that, we're trying to make it really accessible, and we also deliver applied practical training and partnership to support the innovation and implementation that you want to undertake. We don't come to you as the experts, we come to you as supporting partners. You are the experts, we just help you in terms of determining how to get it done and how to make what you implement sustainable over time. Excuse me. So, as I said, you can optimise your workforce through implementation of evidence to deliver more effective and efficient and safe care, and you can energise the individuals in your workforce through growth and innovation. And you can do this through the resources that I'm about to take you through. So we've got free evidence-based resources, and we have free developed training, coaching programs. We're not talking training in clinical training, we're talking training in problem solving, critical thinking and implementation success. So these are the sorts of resources that we have. So there's a Knowledge and Implementation Hub. It's free, it's on our website. For those of you who may be familiar with PaliAged or LDAC as resources, is there a few nods in the audience? So these are developed by the professor who developed those. So similar, I guess, translatable resources that are all free and downloadable and accessible for your workforce. And they're pragmatic summaries of best practice in a range of topics. I think there's over 15 different topics, and under each one there's about 10 to 30 subtopics, so it's a bit of a choose your own adventure. Some of the topics include clinical governance, staff burnout and the use of technologies, which have been mentioned often in the talks that I've been in this morning already. The aged care sector is diverse and we recognise that, so the pages are searchable. You can not only find resources on a particular topic, but you can actually also search these resources by the setting that you're coming from and looking for support in, and you can also search the resources by the workforce that you're actually looking to provide the information to. So you can say, I'm interested in dementia, in sundowning, what's the best practice for my staff to be able to implement? My staff are care workers in the community setting, and it will only give you resources that are relevant to their scope of practice and their setting. So this is just an example. These are just examples of the types of subtopics, I guess, that we cover under our topic headings and the resources that we offer. And like I said, it's a bit of a choose your own adventure. Click through and see what is of use to you. So that's one set of resources that you can understand took an enormous amount of, I guess, skill, expertise, subject matter expert consultancy, as well as end user consultancy to develop, and we hope that it's of use to you and your organisations. My area that I'm responsible for is workforce capacity and capability building. So we've developed a free training program. The government wants to call it a training program. I'd call it a coaching program because we don't train anybody. It's not skills development in the traditional sense. We're not teaching you how to deliver medications. We're not teaching you how to look after people safely. As I said, we're teaching people how to think and critically analyse what their problems are and figure out what the best solutions to those problems are. So we provide the workforce with those skills to be able to innovate and implement change through the Innovation Training Program, or ITP. It provides workers of all levels and all experiences with a scaffolded learning approach and gets them to develop tools and skills that they can apply in their own context as the experts in their context, to identify what evidence might best support them to solve their problems. Those people that come through the program are supported to co-design a project that will implement an evidence-based solution to a problem or a challenge. The problem or challenge is agnostic. We're not particularly fussed about what your problem or your challenge is. We care, but we don't have a ready-made solution for you. What we care about is empowering you to make those changes. And how to implement them successfully, one, because change is hard to do, and how to implement them in a way that's sustainable, because we all know there's a lot of things that get stood up and then 3 months later, 6 months later, everything's reverted back into the same old business as usual. So they come with a problem or an opportunity, they undertake the training, there's multiple delivery modes available. At the end, they leave with a robust project plan and a pitch. They have to be able to sell their idea back to their co-workers, back to their managers, back to the clients that they serve. If they can't do that, you're never going to get the change to be embedded in your organisation. We don't provide funding for the actual projects themselves. That has to be sourced from within the organisation. But we hope that the people that come through the program develop up those transferable skills so that they're not just tackling the project that they came with, they're tackling the next one and the next one. Because everybody knows that the only thing constant in aged care at the moment is change. So we have these skills, attitudes and behaviours that we focus on. So it's an action-based learning approach that the worker and the organisation not only get a plan, as I said, to tackle their immediate problem, but they use that as a vehicle for learning so that they get the skills that they need to apply over and over again. And I always tell people my job is to make myself redundant. I do not want to be telling people how to do the things that they need to do. I want to be teaching them to do it for themselves. And I think as a sector, we've been told over and over again from the top down how to make changes that don't necessarily fit in your organisations. So unless you build the capacity in your organisations to make changes that are appropriate, then we're not going to change the narrative. Excuse me. So we talk about critical thinking skills, problem-solving skills, understanding the importance of that academic literature and evidence that I was a bit rude about before, but how to adapt, adopt and apply it, and how to implement successfully, and how to undertake project management, and also how to be able to measure if you've made a difference. You need to be able to prove to your clients, to your team members, to your management, to your board, that whatever you've implemented is working and is worth backing. So feedback from those who've undertaken the training and their respective managers indicates that the innovators were not only successful in driving their improvements and solving the problems that they came with, but we've got lots of examples of where those people now have been identified as change champions within their organisations because of the skills that they've developed and brought back to the organisation. And so now they're actually being asked to pick up new projects and undertake further changes in their organisations. So that's the aim that we wanted to achieve, is that transferability. One thing that I thought you might be interested in is recently we've run themed cohorts. So again, all of these problems quite often are system-wide, systemic. Everybody's dealing with the same sorts of problems, potentially tackling them in different ways. So we ran themed cohorts for food, nutrition and reablement, and the evidence packs, all of the evidence was gathered to support those cohorts. We're not telling people what to implement, we're just saying these are the options, what fits for your organisation best. And so we've run those cohorts, we probably will run them again, but if you're interested in those particular topics, all of that best practice evidence is now on our website available for free. And next week we're about to commence a workforce retention and recruitment theme topic, and again that workforce evidence is available for free on our website, so please make use of that. You can see it better than I thought. All right, so these are just examples of the different subtopics. So you follow what interests you and unpack and follow the evidence trails through, and it comes through to provide different resources on the different topics that may be of interest to you. So I said I'd talk about leadership capacity next. So that's another offering that we have within ARIAA. So recognising that everybody in this sector is extremely passionate and great at doing what they're currently doing, which is delivering their business as usual services. Often our senior managers and team leaders are promoted because of their clinical expertise, or they're promoted because of longevity in the organisation. They're not necessarily promoted into roles where because they have leadership experience and they don't have the experience in implementing change, supporting culture change, and implementing new ideas into practice. And so we recognise this, and that's not a criticism, it is a support. Again, we're a free support, and so we are building up a program of work to support leaders to support their teams to change and implement change. So that's in recognition that, again, leadership styles need to adapt and change as well. The research that I was rude about indicates that supportive leadership is one of the key factors in determining whether a project will be successful in its implementation and its sustainability, because it's not just in putting it in the first place, it's getting it to last. And we've also identified from the research what key skills, behaviours and knowledge and attitudes and the methods are needed in order to be able to deliver innovative approaches and implement quality care and services. So on that foundation then, the leadership program that we're developing at the moment, we've piloted it as a short course, recognising that access to the people that we're trying to target isn't always easy either. So we're looking at 16 hours of commitment over 8 weeks as a reasonable contribution, enough to make a difference in the first instance, but not enough to be a burden on the organisations sending their people through these change programs. We're targeting mid-level management, either team leader, as I said, or maybe service level manager roles. And the course is offering modules on strategic leadership for change and understanding organisational context, so understanding what the problems are and what the context is, understanding the specific skills that an individual needs to support implementation of change. So then it's the how do you implement implementation, so what processes do you follow, what strategies, what frameworks, whatever resources float your boat, but you need some and you need to follow them. And then how you bring others along, because again, change is hard to do and it's hard to convince others to do. So it's focusing on those 4 key areas, and it has a focus on these behaviours, attitudes, skills and knowledge. So this short course content will be available later in 2024. Oh goodness, that's where we're in. We're already in nearly July. It's a bit scary. But yes, there's going to be more information on our website shortly about this, or you can talk to me about it and ask me questions. But we are really keen and really passionate about supporting you as a sector. ARIAA is industry-led, so if there are things that you think as a sector you need, you tell us and we implement, we try and support you to implement them. We're not telling you what we think you need. It has to be driven by you as a sector. My last slide is a plug for our conference, which is next week. So it's a very different conference. It is solutions focused. It is held in Adelaide. It's pouring with rain this week. Hopefully the weather will be better next week, but just out of interest, if you're available, we'd love to see you there to discuss more solutions, and I really thank you for your time. That's it. Are we doing questions or am I running away?
No.
Oh, okay.
Thank you very much, Rebecca. Did we have any questions?
No, they're all asleep after lunch. That's fine.
I really love the approach. No 2 aged care homes are the same, even within the same organisation. Each home has its own culture, its own needs, its own problems, and being able to offer solutions that are driven by the needs of the stakeholders is just fabulous. So,
yeah, so Ramesh, who was from Uniting, I think in a session I went to before, he said the fantastic thing of, ask the right questions and start from the problem first. And I think that's the thing, is that we can't come in and assume that just because a solution has worked in one home or one context, it's going to work in the same organisation in another home, and as you said, even between groups of residents, things are constantly changing, and so you do need to be flexible and agile in that approach, and I think building in that flexibility is always part of our remit, is encouraging that growth mindset rather than a fixed mindset, and understanding that yes, this seems to be appropriate. You need to consult with your stakeholders, you need to co-design, but you also need to make continuous improvement a part of any project so that it can adapt over time as well.
Yeah.
There was a lady at the back with her hand up.
I think I'm in a minority of the conference. We come from a small chip market service.
Mm-hmm.
So how relevant is your training to say a smaller, not a residential?
So if it wasn't clear, we support the whole sector. It's residential, home, community. It's completely agnostic as to size of the organisation. We actually have a soft spot for the vulnerable and smaller organisations, and I think I said to somebody earlier, I grew up in Katherine in the Northern Territory, so regional living is my bread and butter, and I want to make sure that there's equity across the sector. Our training is scaffolded, so it's completely agnostic, or unbiased by what level of person comes through. As long as they're improving their skills, it's a win. It's not an expectation that they come through, with a big team behind them and a large support. And making small changes is better than making no changes. So very happy to support anybody.
Any other questions?
No, I'm running
No?
away.
Thank you very much, Rebecca. Please put your hands together.